drawing the veil away from sexual and gender-based violence in Afghanistan. Political uncertainty, abject poverty, and culture practices have combined to keep Afghan women truly behind the veil. Women have borne the brunt of conflict in both private and physical spaces. Domestic violence is routine and forced marriages are the norm. According to a nationwide research in 2008, Global Rights Afghanistan concluded that 87% of Afghan women and girls are faced with at least one form of sexual, physical, economical, or psychological abuse. Sexual violence is the most direct link between sexual and gender-based violence, or SGBV, and HIV. It increases victims' vulnerability to HIV. The aggressor uses physical violence, verbal threats, or coercive tactics to pressure the victim. Unable to negotiate safer sex is at an increased risk of HIV infection. There is an urgent need to address the correlation between sexual and gender-based violence, HIV, and sexual and reproductive health to reach the vulnerable, especially women. Afghan Family Guidance Association (Afga), IPPF's member association, has promoted sexual and reproductive health and rights in the country through their family welfare centers. Afga works in difficult and challenging settings such as prisons and juvenile homes. They provide harm reduction services to people using drugs. They deliver cutting-edge work that addresses SGBV to reduce sexually transmitted infections, including HIV, among women and survivors of SGBV. After her marriage, she was unable to conceive. The family desired a child, especially a male child. Her husband and his family would use physical violence at the slightest provocation, along with threatening her to divorce and abandon her. This affected her health till one such a day her mother-in-law, fearing for her health, took her to a family welfare center, FWC, run by the Afghan Family Health Center, Afga. With the support of Japan Trust Fund, Afga has worked on a project from 2011 to 2014 to break the silence on SGBV and surrounding issues by engaging with key stakeholders such as religious leaders, police personnel, community members, and youth volunteers.
Afga is working in the field of reproductive health in Rai, with the aim to improve the health status of the family through health service delivery point. In the advocacy, Afga currently has 22 service delivery points in providing more than 500,000 services on a yearly basis in 4 provinces of Afghanistan.
SGBV and HIV awareness sessions conducted through Afga centers reached out to community stakeholders. This has facilitated increased access to services and reduced stigma and discrimination around these issues. It has also created an enabling environment for SGBV survivors and people living with HIV to seek healthcare and support. The core strategies have centered on community mobilization, institutional strengthening, and capacity building. service delivery, partnerships, and referral systems. This has led to increase in the number of clients accessing integrated SGBV, SRH, and HIV services. Through Afga's Family Welfare Center, the integration of SGBV into SRH services has been central to all the strategies of the project. This experience has shown that it is critical to implement an integrated approach to addressing GBV, STI, and HIV.